Hi, everybody. Welcome to the Fringe. Today, myself, Alyson, our guest today is our pelvic health medical
Hey.
director for Fringe, Liz Frey. So welcome, Fringe. Welcome, Liz. I'm so sorry. Welcome, Liz. We uh, we have a long history, Liz and I, and have worked together in the past. We both have medical backgrounds, very different though. My background is as a chiropractor. Liz is a pelvic health physical therapist, which we'll talk about what that even means later on in our podcast today. But today we're going to kind of start with a story of how Fringe even remotely got into ending up developing a light therapy product for pelvic health. It was nothing I thought we were going to do. So that seems to be the story here at Fringe, which is that, at the end of the day, we're trying to help people with light therapy. And a lot of the times our customers are the ones who really help us understand the paths we should be taking forward by them reaching out to us, asking questions, saying, have you guys ever considered, making this, or do you know anything about this? And that is very much so the story of Fringe getting into uh, pelvic health and light therapy for pelvic health. So thank you for joining us, Liz. Thank you for being on our team. Before I get into kind of really how it started, do you mind sharing with our audience just what is a pelvic health physical therapist? Because I I really still think that it's such an underutilized part of your profession, and that most women at some
Yeah, for
point in
sure.
their
Thanks.
journey
So I'm
through
Liz and I am a
womanhood
pelvic health
should
physio.
be visiting one.
And what it means to be a pelvic health physiotherapist is that I've done credentials, like specific courses, where I'm allowed to essentially do internal palpation. So internal vaginal and rectal work with women. And I think this is super important to note in that when we think about our pelvic floor muscles and our deep core muscles, especially for women as we're transitioning with pregnancies, postpartum, menopause, etc., we really do need to be able to palpate, to touch and feel the muscles that we're intending to work on. And so with the designation of pelvic health physio, you're actually allowed to do internal vaginal and rectal work where we can touch, palpate the muscles that we're intending to target and then actually work on them. So that's really what it means from my perspective to be a pelvic health physio.
Yeah, and so, I mean, obviously, most women who've gone through childbirth, the minute you go into that next mode, which is you as a mother, the last thing you're thinking about is taking care of yourself. And so the story goes that as soon as we got into red light therapy, and also keep in mind, I'm the founder, co-founder and owner of Fringe. My background is chiropractic. I'm, a 50-year-old woman. Our scientific director is also a 50-year-old woman with a background in medical. Our medical director is, another woman. I mean, you naturally sort of attract a lot of the times what you care about, what you're going through, what you read about, you kind of put that energy out there and it comes back to you. So as soon as we started launching red light therapy for Fringe, this was a few years ago now. This was our basic red light therapy therapeutic pad. It has red and double near infrared in it, super healing, incredible to use all over your body. And of course, we talked about utilizing this in the lower abdomen for PMS, for menstrual cramps, for endometriosis, for PCOS, even for topics like fertility, for all sorts of gut issues. But very quickly after launching this, we had women reaching out, asking if they could sit on this for their tearing during delivery. That was the very first reach out is women reaching out to me saying, is this okay for me, to sit on? I tore a lot during childbirth, or I had, a lot of pain or hemorrhoids or whatever it may be from the delivery process. And very quickly, know, I was like, "Yes, yes, it's so gentle. It's a very natural, way, to go and promote healing to tissues all over our body." So promoting blood flow, promoting tissue, repair and regeneration, and then reducing inflammation as a big effect. And so they would report back. I've been sitting on this wrap. It's helping so much. Oh my gosh, you need to tell more women about this, which very quickly led us to reading a lot about red light therapy being utilized for women's health, which very quickly, I thought, oh my goodness, look at all of these studies that are using red light therapy transvaginally. And I think at that time I reached out to you and said, Liz, I think you need to come join the Fringe team. These are the questions we're getting asked, and women are asking if they can use this light internally. And all we have is this pad, and there's all sorts of creative ways, women are trying to utilize this right now to help the external tissues, but they're asking about helping, the internal tissues. And so there you go, guys. For every story here at Fringe, there's usually some sort of weird, you know, necessity that leads us down the road. And so I reached out to you, and I, at the time, had reached out to 3 or 4 other pelvic health physical therapists that I knew. And I said, listen, I'm thinking about doing this. I don't really see a lot of options for consumers. And I want to make sure that what we design is designed by women pelvic health physical therapists, meaning the shape, the size, the curvature, the materials. I knew from reading all the research that was available what kind of light we needed, how much light I thought we needed. Um, but yeah, sort of take me back to when I reached out to you,
Yeah.
and if you thought I was crazy, and then really the
Well, I
the
think it's
backstory
interesting,
behind
Ellie, the way
why we
you
designed this the way that we did.
wand.
This, by
I
the
think
way,
it's
is the
interesting, Ellie,
Fringe
how
red
you're
light
saying
therapy
how there are women
pelvic
on
health
the
wand.
team and how postpartum
Yeah.
and through menopause, we've realized that we really do need to have products for women to help them through this journey. And that was even how I became a pelvic health physio. I never thought in a million years that this would be the path I would go down. When I was in physio school, I was like, no, I'm going to do sports physio. That's what I'm going to do. And fast forward a couple of years, I had children and was like, oh, whoa, I
Right.
need help.
Right.
Right. And so it's through my own experience, even that I realized that public health existed
Yeah.
and truly
Right.
how helpful it can be. So I love, I love bringing new products to my clients, obviously, to help them heal. So when you reached out to me with the idea of the pelvic wand and asking for feedback and so on, I was so excited because I mean, and fast forward even a couple of years now, I have so many clients that I've recommended the wand to that have benefited. So it was, I mean, it was a kind of a hell yes right from the get go that I was excited to be a part of the team and to be a part of the development of the
Yeah.
product,
Yeah.
essentially so I can help more women. And that's, I mean, that's truly what we're doing with it. You had mentioned a little bit about the design of it though. So I want to just chat about it for 2 seconds to anyone that's listening, but also watching. They can see that the wand has a really gentle curvature to it so that when you insert the wand vaginally, that it will, I'll say slide in, it will go in quite comfortably. And if you look at the actual size, like the circumference of the tip of the wand, I think this is super important to note. It's 2 centimeters in diameter across, which if you look at like, say, the size of my thumb for those that are watching, it's really comparable. It's not meant to be intimidating at all for women. And if it is, women, especially women with pelvic pain, can use it externally to start, like along the vulva area. They can even just use, as we were talking about a second ago, postpartum, even just the tip at the entrance of the vagina. So if you've had an episiotomy or a little bit of granulation, tearing, etc., externally, even just the tip can be really helpful. And then, of course, you can insert it for affecting the muscles that are like pelvic floor deeper inside, for all of the healing nature there. So just to rewind in terms of the size, the number of light chips that you can see that there's light through the entire shaft of the wand. So it's not just in one small segment. So even when you're using it externally or the tip, you're still receiving all the benefits with it, right? So I think that's super important to note. And I was so excited to be a part of helping with the design of it, right? So
Yeah, I sort of looked at the market and thought, "Oh, we need professionals to be, designing this." And having been to so many medical conferences and met so many pelvic health physical therapists, I knew there was very much so going to be an approach to this that was very therapeutic. Of course, people look at this and of course are like, "Is that what I think it is?" And I'm like, "Yes, it is what you think it is." And you know what? Our name is Fringe, and that implies many things, but we're not uncomfortable talking about things we should be talking about to make people feel better.
no, and you know what,
Who've had
Ali?
babies should
Men
not
as
be
well.
standing around in a circle talking
No,
about peeing their
I
pants.
have the
That
fringe.
is common, but it
I
is
was gonna say I
not
have the fringe,
normal.
like the box
Men
of
as
for the
well.
wand,
Yes.
along with
Oh
a couple
gosh,
other
that
products,
has
like
been
just literally displayed in my practice. And I treat men, I treat women, I treat, everybody. And I'll have plenty of men even asking about it. And they'll say, "Is that what I think it is?" Exactly what you said there. And I'll say, "Yes, yes, it is." And I feel like it is such a fantastic segue to help educate and inform men or women about what this actually is and the therapeutic uses behind
yeah,
it, etc.
yeah,
Yeah. So I will.
yeah. Yeah, absolutely. Okay, so we talked about the features of it, the shape, the diameter, the design, the curvature. It was all designed by pelvic health physical therapists, female pelvic health physical therapists. This is medical grade silicone, which means that it is safe for use with a water-based lubricant. Um, it is, like you said, it's very not intimidating, which is really important. The light that is in the wand is important to discuss. We have both red, near infrared, and blue light options in this. So red and near infrared are the most commonly talked about. We'll talk about them on many, podcasts and courses we teach and in our emails and social media, but red and near infrared is really about energizing the cells in the tissues that are receiving the light. Doesn't matter if it's our brains or our organs or muscles, ligaments, tendons. At the end of the day, the tissue is the tissue. It receives the light. The cells become energized. They help bring blood flow to the area, so fluid flow to the area, which delivers nutrients. They help with tissue repair and regeneration, which will be huge for Liz to tell us why that's so important. And then they help with pain and inflammation. And when it comes to our bodies and when they are injured or not working well, there is a common theme, which is that if we can bring blood, nutrients, oxygen, reduce inflammation, and help the body repair and regenerate, we're going to feel better. And so the red and near infrared setting on this wand is probably the most commonly used for all the things we're going to talk about. And then we'll kind of hit on why we put blue light in it. I think for me, when I was reading all the research that does exist in this space, and let me always give a disclaimer, I don't read the research all the way through. I hand it over to our team. I read the summaries and I say, is this what I think? Does this say what I think it says? And really near infrared to to us was probably one of the most important lights to be delivering transvaginally for a lot of the conditions we're going to talk about. This wand also does have 4 levels of vibration to it, has a really low, gentle mode of vibration, which we'll have Liz talk about why you would use that, and then, ramps up to higher hertz levels or vibration frequencies. So yeah, Liz, let's start with conditions that you treat in your clinic and you kind of going through how you work with what settings on the wand for those conditions. Because truthfully, this isn't, I think a lot of people think this is for menopausal women, and it is. Oh boy, it is. It's for perimenopause and menopause, but there are a lot of conditions that I have been so amazed by hearing people's success stories. And we literally probably once a week as a team read our testimonials that come in, our reviews, and we have so many testimonials on this wand, and all of us typically still kind of gasp a little bit. So let's talk about the top 3 conditions that you see in your practice, and that you are utilizing the light therapy wand, and sort of how you're talking to your clients and patients about it.
For sure. So in my like clinical setting, I would say top 3. The one of the demographics, one of the types of people that I see most often are women who are postpartum, and the wand is unbelievably valuable for the postpartum woman. And so initially, if there has been trauma, tearing, and episiotomy, even C-section scar, like the wand actually has a great little curvature to follow the C-section scar. But I would say to the women to use the wand externally in that case, right? So that's early healing. And the reason I do that is because I want to have women have an increase in blood flow to their healing tissues to help promote healing and tissue repair and regeneration. To increase even the collagen and elastin production, the little structural integrity pieces of our tissues early on. So that would be from the healing perspective. And then as women progress in their postpartum journey, some women will be left with what we'll call hypertension, like a lot of tension in their pelvic floor muscles. That could be from scar tissue that's formed within their healing journey. That could be from even where they're holding a lot of their tension and a lot of their stress within their pelvic floor muscles. Maybe they're anxious about intimacy and there's a tension within their pelvis. So I will then utilize the the lower levels of vibration, in addition to the red light therapy settings there. So when we're using low level vibration, that's like the first 2 of the 4 levels of vibration, that will help relax the pelvic floor muscles. So sort of soften, soothe, relax. Women just say it just feels nice. They actually look forward to doing their pelvic health, like I'll say home stretches or their breathing, all the different things that I'm giving them to do in conjunction with using the wand, because they feel like the vibration and then the gentle warmth associated with the near infrared setting. They actually feel just like it's a nice sort of self-care routine to do. Okay. So that would be for if someone has a lot of tension postpartum. And then on the flip side of that, some women will have basically a dysfunction where their brain and their pelvic floor muscles might not be connecting well. So they'll have low tension. They won't be able to contract the muscles the way they once were able to. So the way a woman would know that they had low tone or weren't able to contract well could be that they're having actual incontinence, a little bit of like urinary leakage. They just can't hold it when they need to. Or when they cough or sneeze or laugh, they're feeling like there's a little bit of leakage. Or some women will report a sense of heaviness. Prolapse is what we would call it as therapists, but like a descending of the organs, the muscles just aren't strong and contracting the way they once did. So in that case, I use the light therapy settings, usually red and near infrared. Now, if someone's sensitive to the heat generated, the gentle heat generated with the near infrared, then I say, fine, just use the red light setting. But then I would also use that in conjunction with the 2 higher levels of vibration. And the reason being there is that then the brain can feel the vibration in the internal like pelvic floor muscles and say, oh, those muscles. And we can reestablish that connection so that you can actually do strengthening exercises for the muscles. So I always recommend the red and near infrared light setting, unless someone's sensitive, like just to recap, unless someone's sensitive to the heat generated with the near infrared. And then I often will say, hey, let's stack or layer the therapies and either use the lower vibration settings if you have a lot of tension, or the higher vibration settings if you actually need to work on developing the tension. So that would
Yes,
be
and,
one
this
population.
is
Yeah.
important because, I mean, at the end of the day, once you've had a baby, these are not things that you're paying much attention to. You're not aware if you have low tension or high tension in your pelvic floor. You mainly just know things don't feel the same. And obviously, in me learning so much about what you guys do, at the end of the day, there can be incontinence from high tension and there can be incontinence from low tension. And so, step number one is saying things don't feel right, whether it's pain or function. It, even though it seems common, it's not normal, to be experiencing those symptoms, essentially. So, yes, postpartum, also to summarize what you said, a lot of women start with just laying the wand externally, helping with healing the external tissues, and then they work towards internal healing, utilizing it probably a few times a week. Is that what you
I do
recommend?
recommend, yeah, so I do recommend 3 to 5 times a week using the wand, and I will note, we haven't mentioned this, but there are settings on the wand where we can go into a 50% light
Right.
intensity, right? And
Yep.
then here's back to 100, so those that are
Yep.
watching can see me toggling back and forth. So if someone is, um, sensitive to the light or just apprehensive, they can start at a 50% mode. I think that's like an important piece to note. And then you don't have to start with 10 minutes. You could
Right.
start with 5 minutes and
Yep.
see how comfortable it feels, and then work your way up to feeling like, okay, I've got 10 minutes to spend on this, or I'm working my way up to that. So a gentle approach using less time or the 50% intensity is totally fine. But for the most part, I do recommend 3 to 5 times a week for women so that they see results within a few weeks of using the wand. So that's
Ab
postpartum.
Absolutely. So that was condition number 1,
Yes.
postpartum. Yes.
So, condition number 2 that I see quite often in my practice is just pelvic pain. And I'll use this like as an umbrella term. And there's all different diagnoses within this bracket. But if you
Yeah.
suffer from pelvic pain that could be from endometriosis, it could be from interstitial cystitis, it could be from vulvodynia, like a vulvar pain, it could be from vaginismus, which is where we have like sort of a closing down or a connective tissue dysfunction that doesn't allow you to use tampons or have intercourse, those kinds of things. A lot of tension is often one of the underlying issues. And so if we can use the wand external or internal, depending on your comfort zone, to help increase the blood flow to these really restricted, often very, I'll say tight muscles, then we can bring oxygen and nutrients to the muscles to have a healthier situation, essentially. So increasing blood flow to really tight muscles can be very beneficial and relaxing. If we can increase the energy production, which is what the light therapy does. So energy into the cells, then you can have a healthier sort of cell in general. And that could be to reduce inflammation, that could be to help reduce pain. And again, we're also affecting the neural pathways here. If you have really restricted muscles, then all the nerves that have to intercourse through and around these muscles are often being compressed. Let's call it
Yep.
pinched. And then
Yep.
that is causing pain. The nerves are what sends the information to the brain to say, ouch, I'm sore. This isn't comfortable. So if we can have the muscles relax, increase blood flow, increase oxygen and nutrients and energy to the muscles, as well as the nerves, then we're going to have a whole lot less pelvic pain. So that's why I use the light therapy. But then I've also mentioned, and I'll repeat it for this population, the low level vibration can be unbelievably relaxing, right? So if you were to combine low level therapy or low level vibration with the light therapy, in addition to
Relaxing.
even, yes, relaxing your whole parasympathetic system, breathing through the diaphragm, mindful meditation, all these sorts of things stacked together, then it can be really, really helpful for my ladies that are suffering with pelvic pain. So that's a second population that I do see quite a bit of, and how I would utilize the wand. With this population, I will emphasize that that gradual, slow, low approach is super important. So I rarely do I say do it for 10 minutes. I
Right.
might even start with 3 minutes, something really low so that someone feels relaxed, feels comfortable, has a positive experience, and then feels like encouraged essentially to use the wand and to use the therapy more frequently. So building from 3 to 5 to 7 to 10 minutes, and adding in the vibration only after they feel comfortable using the light. So it doesn't have to be an all or none. I can stack the therapies and the timing as women become more comfortable using the wand and the therapy, right?
Amazing.
That's the second
Yeah,
population.
I have learned so much about that population. Obviously, going to pelvic health medical conferences with you has
Mhm.
been incredible. We go to one every September, Liz and I, with it's called Pelvicon. It's just an amazing event, and it's just all pelvic health physical therapists and Alyson there making light and learning what do we have to go create to help, these providers in their clinic even more. But obviously, I've learned about so many amazing conditions that we're able to, shed a little light
Oh,
on. Okay,
absolutely. Last
condition number
population, condition 3,
oh, we know it because we get
near and dear to us. I'm
near.
perimenopausal.
Yep, me too.
So it's the menopausal women that I have a ton of who come into my practice, and they come in with a whole host of like essentially genital urinary symptoms of menopause. So some women will come in and they will be suffering from, let's look at it from a tissue perspective. They will have tissue dryness and tissue fragility. So it's like it thins and it's just so fragile. Sometimes there's even little fissures, like little, almost like paper cuts um, within their vaginal tissues. And so using light therapy for vaginal dryness is it's a game changer. It actually
Game
really
changer.
is. I think I can say
Yeah.
that pretty confidently. So the way we increase lubrication to our tissues is by increasing blood flow. So using the wand, even externally, is going to be so powerful to increase the blood flow to the tissues, which brings oxygen, which bring nutrients, which helps with secretions and hydration of the tissues. So for that symptom of menopause, like dryness and fragility, this is amazing.
Yeah, and the
Um,
testimonials, I will say, are quick. So that is,
mhm,
when people use light therapy, what should I expect? When should I expect it? Well, everybody's going to be very different, but in a short term effect of
yeah.
light therapy, the increase in blood flow is something that you can experience like
So
immediately.
yeah, and so that you bring up a really good point there where I do recommend for my menopausal women to, if you're going to be intimate, to use the wand as an, I kind of joke, as a warm up, as something that you would do pre-intimacy. Because if you're going to use it that day anyway, then let's use it where we really want to have the increased blood flow at that time. So, I mean, the symptom or the benefits will be longer lasting, but I like having someone use it pre-intimacy for that reason. But
Absolutely.
beyond just tissue like frailty and thinness and drying, a lot of menopausal women will come in and they will say, "I have never had urinary leakage. I have been able to cough and sneeze, and I used to be a runner, and all these things, right?" And they will say that as they're going through menopause with the reduced estrogen, everything, and they're upset about it, fair, but everything is atrophying, so drooping and sagging, and they do not have the muscular tension or tone that they used to have. And they're finding that when they have the urge to go to the bathroom, they just can't stop it and they're having leakage. So for that population or that those symptoms with menopause, I always recommend the red and near infrared light therapy. And the reason being there is because red light penetrates at a specific depth, but not that deep. The near infrared will actually help penetrate deeper. And that's what we're trying to target, or is our deep muscular system here to help bring blood flow, bring oxygen and nutrients, collagen and elastin production, which is again the structural integrity of these muscles, and help develop strength and I'll say plumpness to these muscles so that women can use them effectively to reduce urinary leakage. So I often recommend that in conjunction with the higher level vibration, as you can imagine, to help women also then connect the brain with the muscles and then do strengthening exercises or whatever else I'm asking them to do. For this population, I personally use a bit more, and I don't know if you could use the word aggressive, but kind of aggressive approach where I say, I need you to use this five
Right.
times a week. This can't be a once a week, oh, I think I might. It's no, like with anything, if you want to develop like really strong biceps, you can't do one bicep curl and hope for the best. You actually have to use the device consistently. And I say, up to 10 minutes. I might start a little bit less depending on someone's comfort zone, but usually it's a 10 minutes, 5 times a week. And then when we see the results, then we can go back and
Pull
step back
back.
to more of a
Yeah.
maintenance mode of, 2 times a week or whatever it might be. So
Yeah.
that's quite different.
Absolutely.
Right?
Yeah.
So that would be someone who's, sort of having low tone and really not connecting well with their pelvic floor. And then on the opposite end, if someone has um, pain with intercourse, which is another symptom of menopause, and that could be from the dryness, it could be from the atrophy, like there's tons of different reasons, then I'll just shift my focus to not necessarily using only the high level vibration, but the lower level vibration to help reduce tone. So those would be like my postpartum, my pelvic pain, and my menopausal women. Those are my top three, women that I see in my practice that I have seen like amazing benefits from using the wand, not with them, but them using the wand at home as an adjunct to the therapy that I'm providing. And I don't think we've
Yeah.
really mentioned that, but that's the intended
Yeah.
use of the wand. So like no one's coming into my practice 3 to 5 times a week. I'm
No.
saying, hey, here's the tool, purchase it. And this is how you're going to like actually see greater results quicker at home. Um,
Yeah, this is something so important we talk about on lots of different topics of red light therapy is that red light therapy isn't new. It's been around for a really long time, 50, 60 years of published data, really in the world of transvaginal red light therapy or photobiomodulation. It's been over the past 10, but really 5 years, but 10 years that there has been publications. A lot of it is laser, but a lot of red light therapy research is laser. And laser is a form, a way that we can deliver red and near infrared light and other wavelengths of light as well. And then we can also deliver red light therapy via LED light. This is LED light, which means it's not as intense as laser. It doesn't generate as much heat as laser, and it doesn't have to be used under, clinical guidance like a laser does. The safety profiles incredible. It has to be used more regularly and for longer periods of time to deliver similar results to what you would receive via a laser form of light therapy. So laser, high intensity, done in a clinical setting. It can be done for your shoulder, in a med spa, for your skin, and also at the OBGYN for the, different pelvic conditions we've talked about today. Or you can take a device home, use it more frequently, low intensity, longer periods of time. That's how you tweak dosage of light. Light, the teacher for light is in the sky. That comes from the sun and has incredible healing, you know, components to it. We learn a lot from it. And then we're essentially taking these forms of light, red and near infrared on this, specific setting and delivering it to the body. So you can, when I started learning about this, I obviously looked into the laser treatments that were available. What kind of parameters are they utilizing with their light? What kind of power? What types of light? What wavelength? And then wanted to bring as as close to that as possible into our device, but make it lower intensity, how we would have to adjust for it being LED light. So that's an important message. You can get laser pelvic light in a medical clinic, and you would get incredible benefits from it. Has incredible benefits from it. But if it's something you want to bring into your home to utilize more regularly, then LED is definitely where it's at. Okay, so we talked about top 3 conditions.
I think, Ellie, what we should mention are if there are
Yeah.
contraindications, because that's a huge question that people usually want to
Yes.
know, like, is this for me? Can I use this? That kind
Yes.
of thing, right?
Yes. Yep.
So,
Absolutely. So how do
yeah.
you talk to your clients about that?
So essentially, there are very few, as you know, but there are very few contraindications to using LED light therapy. And for the reasons you've already mentioned, it's super safe, it's low
Safe. Yeah.
intensity,
Yep.
um, those kinds of things. So the only people that um, I note that they can't use it are if you have a active cancer, like a pelvic
Yep.
cancer. Now, if you had
Yep.
cancer somewhere else in your body and you wanted to use the wand, that's fine. You can't use it over where there's cancer, like
Yeah.
over that
And
area.
here's the disclaimer. Put it in a box. It's because it hasn't been researched enough. It's
Yeah,
not because we know it to be detrimental. It's because we don't know enough. And for us, our medical team at Fringe, if there's an area that we don't feel like there's enough information on it, we're going to put a warning on it, and just say we don't recommend using this over an active cancer site because it hasn't been studied enough yet.
yeah.
Someday they may be using light for those types of conditions. We don't know, but at this stage, that's definitely the disclaimer.
And on that note, same disclaimer with over anyone with that, like over the abdomen or internally if you're pregnant. Not enough research.
Yep,
Done. So we
exactly.
just,
Yeah.
exercise caution with that. And then the other one is if you are sensitive to light. So you could be on a
Yes.
medication that makes you more sensitive to light. You could have some autoimmune condition that makes you more sensitive to light. If that's the case, then it's not contraindicated, but it is a
Caution.
major caution. And that's
Yep.
also a good reason why we have our like 50% light mode. So you can start off more gradually. And you don't need to use it for the full, say, 10 recommended minutes. You could start off again with a really gradual protocol. So those would be our contraindications and then our real exercise of caution. But otherwise, it's really safe and really effective for people to use.
Yeah, absolutely. Okay, so I think we've covered it all. I mean, I to summarize, because this is such an important message about our bodies and the changes that we go through and what happens to us when we get injured. But at the end of the day, light that we receive from the sun has always powered our bodies. It literally energizes the cells in our tissues, all of the tissues in our body, and allows them to work better. For the area that we shine light on, it's pretty universal. The outcome is cellular energy, it's blood flow, it's reduced inflammation, it's tissue repair and regeneration. And it doesn't matter if I just injured my shoulder. I need those benefits. That's how my body would naturally heal the shoulder. If I'm going through perimenopause and menopause and I'm saying, what is happening over here? Why is my skin, losing all this elasticity? Those changes in estrogen reduce collagen production, reduce blood flow into our tissue. It doesn't just have to be pelvic tissue. It could be my frozen shoulder. That me, of all the knowing of everything that I know, and the fact that I got frozen shoulder, and I was like, yes, I am going through these hormonal changes. I know what that joint is experiencing. It's a reduction in collagen, it's an increase in inflammation. I have estrogen levels reducing. I could be talking about my face, my shoulder, or my pelvic tissues. The physiological effect is similar, and so when it doesn't really matter if we're putting a face mask, of light on us or using the wand at the end of the day, we're working through trying to support, you know, injuries, pain, inflammation, different stages of life, different hormonal changes. And so it makes so much sense. It's just the shock and awe of looking, at us and the fact that, yeah, we did. We went there. We made this and we want to talk about it. And I know more terms about pelvic health than I ever thought imaginable at this stage. And I'm so grateful to you for teaching our whole team about it. Our whole team. I don't care if you're in operations, customer service, marketing, you now know about vaginismus, vulvodynia, you know about all the changes during menopause that can happen. You know about types of incontinence because people are asking us every day, could this help me? Because I can't find a solution. I'm on hormone replacement therapy. I've tried these other therapies. Could this help me? And our response is very safe. It's very comfortable. It's easy to use. And why not give it a try? So thank you.
Thanks, Allie.
We'll talk to you guys soon.
Bye.